Another question is, what are the signs and symptoms of monkeypox infection?
Interesting thing is that the first 3 weeks, from day 5 up to day 21, there might not be any signs.
Symptoms.
So people can be totally asymptomatic. After that, they would get a fever, they would get a headache, muscle ache, backache, cramps, and then the skin rash starts. The skin rash is quite diagnostic. You look at it and it looks like a chicken pox or cowpox or smallpox rash. So people are familiar with chicken pox. Kids have it, grown-ups have it. So if you see the chicken pox rash on a person, you can suspect monkeypox. The rash starts with the itchy, scratchy rash, and then you get pimples and pustules. The pus is initially just clear pus.
Do you get fever with it?
You can get fever with it. In fact, it might start fever before the rash, and then with the rash you have the fever too. And then the pus would become yellowish, and then the small abscesses, they burst and they release the pus. And after bursting, they become crusted, and then they heal. And first, the healing doesn't leave much of a mark, but later on you can have a dark spot left behind. Remember smallpox? If people have seen any cases of people from smallpox, it sometimes left deep scars, like small holes, like
so
craters, like moon craters.
After.
Here you just get a dark patch,
but
not a scar. So dark patch is left behind, but that also could resolve with time. It's not that it's going to be there forever. It can resolve. So these are the main symptoms, and the most infectious stage is when the pustules break and the secretions are coming out on the skin. Welcome back. We are here at Killing Cancer Kindly with our question and answer session on monkeypox. We've got this question from all over the world. The video is gone over the internet, on YouTube, on Instagram, Twitter, and TikTok. And we had a lot of interest from people and a lot of questions and huge amount of comments. So we've compiled those questions, and Milana Mirishkova is here once again to ask those questions on behalf of all the viewers. So Milana, over to you.
So next question is, how can monkeypox be prevented?
Yes, so monkeypox prevention is easier than preventing COVID. With COVID you had to be very, very, very careful, but this is a bigger virus. It's a DNA virus, and it only spreads mostly by body secretions. So if you do not have close contact with infected people, and infected people are easy to spot, especially if they have the rash or if they have a history of contact with person with monkeypox infection, you stay away from them, you can prevent it. Also, there is a drug, and we'll talk about it later because I know you have a question about the treatment. There is an antiviral drug which we did not have with COVID in the start. And if you have come in contact with someone who has monkeypox, and you are sure that that person has tested positive and now you're at risk of getting it, you can take that drug and you can reduce the chance of infection. Similarly, there's also a vaccine available which can reduce the chance of getting infected.